So right away, we know you have to have cholesterol. Cholesterol goes up for a reason. You cannot make estrogen. You cannot make testosterone, men. You can't make cortisone and a host of other vital hormones without cholesterol. How important is testosterone even in women as you're getting older? It's huge. You can't make it if your cholesterol's not there. So why would cholesterol, do you think, go up? Because what's your body trying to do? It's trying to heal something, but it's also trying to make some hormones. You may need more hormones. It's doing its job. That's what it's doing. You're stopping God. You're stopping its responses by doing that. HDL is known as the good cholesterol because it removes and helps clean the arteries. Now remember, this is what doctors are taught. This is what they think. They never studied cholesterol. The reason why they call it good cholesterol is because it goes through your cholesterol, goes through your arteries quickly, and it goes through quickly. And as it goes through quickly, they think, well, if it's going through quickly, then it doesn't have a chance to harden up and cause plaque. Behind it is LDL. LDL comes around slower inside of your arteries. And the reason why it comes slower is because what is it doing? It's picking up whatever the first cholesterol missed. It's doing its job. And it goes through and it cleans the arteries out and it pulls it through. The reason why doctors are scared, they call that the bad cholesterol, is because when it's there longer, it has a chance to do what? It has a chance to plaque up. It has a chance to actually cause streaking. It has a chance to inflame or oxidize faster. So they don't like that one around. So that's why they always want to lower that one and keep the other one kind of flowing through there. The problem is you can't lower one, you end up lowering both of them all the time. Mythbuster. High cholesterol causes heart disease. Truth. It's not cholesterol, it's the oxidation of cholesterol that causes heart disease. Cholesterol will not cause heart disease unless it becomes oxidized. And we're going to talk about what that means. Truth. More people have heart attacks with normal cholesterol than elevated, proven through research. This is all research from the New England Journal of Medicine. Your doctors aren't reading their own research, obviously. More people have heart attacks with normal cholesterol than elevated, proven now. Because if that was the case, no one would be having heart attacks, right? Because everybody's cholesterol is normal now. There's a higher death rate with low cholesterol than high. That's the truth now. Truth, statin drugs, your cholesterol drugs, lower cholesterol, but not the mortality of heart attacks and strokes. They don't reduce it at all. It's been proven through all the research. You need to know what's been studied. So what's the danger of these drugs? We know that as soon as you take a cholesterol drug, everyone knows, right, who's on a drug, you know it does liver damage. They're going to measure your liver every 3 to 6 months. The problem is it causes severe, we're going to go through this, why, severe neuropathy. Anybody who's on a cholesterol drug or knows somebody where their muscles are getting weaker and their muscles hurt and their muscles are atrophying? Does anyone know anybody like that? Yes. And we're going to show you why it's doing that in a second. Severe joint pain, ligament and tendon ruptures, muscle wasting and atrophy, heart failure. Why? Heart is a muscle. So we know for a fact, if you read the side effects, it won't tell you the heart. It says that it atrophies or causes muscle problems. Yes or no? Your heart is what? One of the biggest muscles, best muscles in your body. So if it's atrophying your rest of your muscles, guess what it's doing to the heart? It's atrophying your heart. Cholesterol is a powerful antioxidant, and it protects us against aging and cancer. It goes up in the body for a reason. When our body has some other disease process happening, the brain will send a message to the liver to produce cholesterol to help you, because that's its job. Depression. The dangers of does anyone know anybody who started taking these drugs and goes into depression? And we're going to explain why that happens here, because it's all science, and it stops the production of CoQ10, which you're going to find out is one of the dangerous things that it actually does. It stops CoQ10 actually being produced in the liver. So how do these drugs work? As soon as you take a cholesterol-lowering drug, you inhibit an enzyme in the liver that manufactures the cholesterol. So all it does is it stops this enzyme that makes cholesterol. So it's stopping it from making the cholesterol. So you keep taking the drug, and it just stops the body from making it. Why is the body making cholesterol? Because it needs to. Now, are we telling you to leave your cholesterol high? That's not what we're saying. We want to know, why is your cholesterol going high? Why is it high? Because there's something else wrong in your body. And cholesterol raises to help you, get you through, clean you, raise your testosterone. It's a powerful antioxidant. It helps fight cancer. It increases vitamin D synthesis. And so if your body's developing cancer in it, what will happen? Cholesterol goes up. If we lower cholesterol, guess what happens? We get what faster? When you stop this enzyme, the liver can no longer make cholesterol. Cholesterol is the body's repair substance. So watch this. Whenever inflammation occurs in the body, especially in the arteries, the liver has to produce more cholesterol to repair the damage in the body as well as the arteries. This is powerful because you're going to find out in a second what the cause of all heart disease is. As soon as you have an injury, especially in your arteries, your liver, your brain sends a message to the liver to produce cholesterol to go up to the area to heal that area. It's a healing that happens. Your brain and nerve tissue is made of cholesterol. Wow, we didn't know. Did you know that? Your brain is made of cholesterol. Your brain and nerve tissue is 60% cholesterol. That's what it is. Guess what happens when you start lowering cholesterol everywhere? You shrink your brain. No, not only Alzheimer's. If you lower cholesterol with drugs, the brain and nerve tissue deteriorate. You're right, it gets smaller, it deteriorates. Because the liver is producing it and sending it up to keep those things moving. Your brain and your nerve system are your central control of your body. It runs you. And that it needs cholesterol. As soon as you lower cholesterol, you take it from the brain and the nerve tissue, and what happens? When you deplete cholesterol from the brain, you block serotonin. Serotonin is the big thing they talk about. What? Depression, which decreases serotonin and causes depression. For 100% fact. That's why it'll say on there, if you see some of the side effects, depression is one of them always. Why? Because you're taking cholesterol out of the brain. Deteriorating muscles, deteriorating your heart, and destroying everything. And why does your cholesterol go up? Because it's doing its job of healing your body. CoQ10. Obviously, who here has heard of CoQ10? Major, important, and very important. It's a biochemical needed to transfer energy from your food to our cells to be used for work, for staying alive and to be healthy. Every time you eat, your brain sends a message to your liver to produce CoQ10 and other things to go in, absorb that, and create your organs out of it. That's how important it is. When you take cholesterol drugs, you stop the production of CoQ10 in the liver. It's an antioxidant. It helps reduce inflammation. Antioxidizes. It stops the oxidation. What's one of the major causes of heart disease? It's oxidation of cholesterol. And so you need CoQ10. CoQ10 goes up to keep you from oxidizing the rest of it. So as you're taking cholesterol drugs, you're lowering your cholesterol. It doesn't matter because as you're lowering your cholesterol, it's still there. There's no CoQ10. It's still oxidizing. And what happens anyway? You still get a heart problem. You still have a heart attack because you ruined everything else going on. CoQ10 is the primary building block for the cells of your brain and nerve system as well. So you interfere with brain and nerve system again. Cholesterol drugs increase heart attacks. This was research done. Researchers followed 114 patients, not one or two, 114 with heart problems. As soon as they began the cholesterol-lowering drugs, they found that every point you decrease the serum cholesterol, there was a 36% increase in the risk of death. You increased your risk of death as it went down, these people did. And that's research.